Some of these violent outbursts and some of these things that are happening perhaps are things that are, I think, reflective of the severity of the mental health issues happening.
Stabbings and shootings have Calgarians concerned, and while the city has taken several steps to reinforce security, especially on transit, mental health issues, which some advocates say is at the root of the issue, can't be addressed with more police.
This is like crisis management at this point, where police presence is necessary, as you say, to control and to provide an element of safety, but it's a Band-Aid solution where it doesn't address what's underneath that.
Dr. Rodriguez says there's a lot of demand of psychiatric assistance in the public and private sector. Adding resources funded towards mental health could make a difference in early detection and treatment.
If somebody is at a breaking point that they reach out and then they're told they need to wait for months to get into talking to somebody, it really, it's shattering. And that window of opportunity can be lost, and a person goes down into a hopeless, helpless cycle and spiral.
Improving access to mental health services and support is one factor. Addressing substance abuse is another.
Addiction, mental health, they go hand in hand. And I feel that a lot of symptoms of addiction are often overlooked. So symptoms of addiction don't necessarily always reflect that a person is intoxicated or withdrawal. It's a brain disease.
She says it's important to pay attention to sudden changes in sleep patterns, appetite, overeating or undereating, memory and concentration difficulties, as well as anxiety, constant crying, and numbness, and always reach out for help.
So if we can learn these things and identify these things on the front end, it would be so beneficial to prevent or at least help to minimize or mitigate all of these extreme examples that are catching our attention.
In Calgary, Silvia Naranjo, City News.